Now with a GMA health alert on cannabis use. A new study finds that using cannabis doubles the risk of dying from heart disease. Our chief medical correspondent, Dr. Tara Narula, joins us now. And studies are showing that marijuana has outpaced alcohol for use in the United States. So tell us and talk us through the new findings about heart health.
Yeah, well, a lot of people know about the risks of alcohol and tobacco and even drugs like cocaine when it comes to their cardiovascular health. But so many people think that cannabis or marijuana is safe because we've seen it become legalized, because it's natural. But in my world of cardiology, we've been seeing a growing number of research studies showing that there is risk to the heart and the brain. And so this study was a big study that looked at 24 other studies. The average age of the individual was about 38. So this is a young population. And they, in fact, found there was a 29% increased risk of heart attack in those who used, a 20% increased risk of stroke, and as you mentioned in the intro, double the risk of dying from cardiovascular disease. Now, these were, as I mentioned, young individuals with likely no risk factors or that were known for cardiovascular disease, no previous cardiovascular disease. So it's really important, the authors say, not to demonize cannabis, but to really raise awareness that there is risk. And I talk about this with a lot of my patients when they come in to see me.
And that's a meaningful difference in those stats. But if somebody is using cannabis, are there like warning signs? Does it pop out of nowhere?
Yeah, and well, as you mentioned, it is so common. We've seen the use in 30 to 50-year-olds triple over the last almost 20 years, so that about 7% of Americans in that 35 to 50 age group are using cannabis on a daily basis, similar to alcohol and tobacco. So it's very common. And so many people, Juju, don't bring it up with their doctor. So when I ask, do you use alcohol, cigarettes, or drugs, they say, no, 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 or yes, no, yes, and they don't mention the marijuana unless you specifically ask. So it's really important to bring it up with your doctor. It's important for doctors to screen specifically for it. And if you feel symptoms like chest pain, shortness of breath, feeling faint, heart racing, or even neurologic things while you're using marijuana, you need to take it seriously and get it evaluated.
Do you think we'll ever get to a point where there's warning labels the same way there are with cigarettes?
I hope there is that in the future. I think as cardiologists and neurologists, we really do. And I talk to my patients about that risk because it is there. And I just think a lot of people are using it. You know, I see a lot of patients even who use edibles and gummies, and even those now we've seen risk with.
There's cannabis drinks now, too.
Right,
Yeah,
and 30%, I think the studies show 30% of people who are regular cannabis users ultimately have problems with cannabis and the effects of it.
Cannabis use disorder, yeah, 3 out of 10 will develop it. Usually if they start young using it or they use it very frequently, but that's essentially a situation where it's interfering with your life, your social, you know, things that you're doing socially, your work, and so there is help if you need it, Smart Recovery or Marijuana Anonymous.
So there can be abuse and there can be help.
Correct.
That's wonderful. Thank you, Dr. Narula. If you or someone you care about is struggling with substance use disorder, confidential and free help is available at findtreatment.gov or at the number that you see right there on your screen.